மாப்பிள என்ன படிக்கிறீங்க?
மாமா பீடிஸ் மாமா.
பீடிஸா? அப்படின்னா?
அட பல் டாக்டருங்க மாமா.
ஓ பல் டாக்டரா?
ஓ பல் டாக்டர்லடா பல் டாக்டர். அது என்னடா உனக்கு பல் டாக்டர்னு அவ்வளவு கேவலம் போச்சா? இங்க வாடா வாய் துற. இந்த வாய்க்குள்ள தலைவாணி பெச்சுட்டு வெத்தலை நடிக்க வைப்ப. இதை எடுக்கிறதுக்கு ஒரு டாக்டர் ஒரு நர்ஸு ஒரு மிஷின்னு போட்டா ஓ பல் டாக்டரா? டென்டல் டாக்டர் சொல்லு.
டென்டல் டாக்டர்.
பயமுடுறா போடா.
மாப்பிள ஒரு டவுட்டு.
என்னடா?
சார் என்ன பண்ணாலும் பல்லுக்கரே போக மாட்டேங்குது சார். போங்க சார்.
என்னம்மா சொல்ற? 2 வேளை பல்லு விளக்குறியா இல்லையா?
3 வேளை விளக்குறேன்னு.
Okay, very good afternoon to all.
Hey, good afternoon. That was a nice welcome. Right.
Thanks, Rudhra. Hope you understood it.
Yeah, no, and I like the song also, Sakala Kala Doctor, right? So I think.
Oh, great. Okay, Rudhra.
See you here.
Yeah. So very happy, but not like every week session today. So today's session is a little bit more special, where the people have to aware at any age group of people who have teeth in their mouth, whether it is the artificial teeth or original teeth, whatever the type of teeth you have in your mouth. So that's an awareness what we are trying to create it. So this is a live session happening on DC Live. So it's a doctor session. We are planning to bring doctors, one doctor every month, any specialties. To kickstart with that doctor session, we are starting with our Rudhra. Hi, Rudhra.
Hey, Sulekha.
How are you?
I'm good. How are you? It's been a while since I met you on DC Live. I know I've been tired. Then it's always nice to be on DC Live as usual.
Happy to see you on new avatar, Rudhra.
Thank you. Thanks for that. I've taken the avatar of RJ here on DC Live, and I'm always happy, to go back to where I started. Dentistry is where I started. I qualified as well, so that's something. Always going back to your roots, the dental roots.
Yeah. So இன்னைக்கு கம்ப்ளீட்டா பல்லு புடுங்கிறது, பல்லு வைக்கிறது, பல்லு ரீப்ளேஸ் பண்றது, நிறைய விஷயங்கள் we going to talk only about teeth, everything. So before we start that, Rudhra, you tell us like how did that journey started and why you transferred from there to here, like something a short about it.
Sure. So okay, hey people, good morning, good afternoon, wherever you are, and it's always been a very happy feeling whenever I come on DC Live, and this is one special show for me because, as I said, it takes me back to my roots, right? And so my journey starts with dentistry way back, but the reason why I took up dentistry was because there was a lot of influence, right? So at that age, when you want to decide what is the education that you're going to do, there's a lot of influence, parental influence, familial influence, and society influence and everything. So my mom was working in the medical background, and she wanted me to be a doctor. And then at that point, and she didn't want really me to go out also and study. So she wanted me to be a day scholar, and that's how I landed up in BDS. Right. So that's one of the major reasons. But I was always very interested in engineering, technology. I was one of those 3 idiots who ran behind technology. And in fact, I had enrolled myself in something called medical engineering when I wanted to do dentistry, right before that. And I somewhere realized that dentistry is not something that I want to pursue, and then technology is something that I wanted to get into. And I treated this as a valid degree from a recognized university. That's what I treat my dentistry as when I finished it. And then I gave it to my mom. I said, this is the dental certificate with prefix doctor. Years it is for you. And then I went ahead with the corporate sector, Sri Lanka. That's how I landed up. My interests, something that I wanted to pursue, something that I wanted to, run with. And that's been my dream. And I always tell this people whenever I work with shifts and night shift and everything, I just say that, I might as well been happy. I hung my certificate on the wall and I would have pulled a few teeth and I was happy about it. And then, but I'm still awake in the night working, and there's a reason for it, and I chose to do it.
Okay. So, I mean, you worked as a doctor also for a few days.
Yes, I did practice. I did practice. That I did not. That's for a few years, and after that also sometimes here and there I used to do all of it. And I'm still with the KSDC, which is the Karnataka State Dental Council, and I'm registered there.
Okay.
So I'm a registered doctor, like your medical council. There's a dental council, and I'm part of the dental council. So.
Super, Rudra. Great. And any fun incident you remember? Then I'll come to the questions, whatever I received few here and there, which I have ready it for you. But any fun thing because when you talk about, go to the dentist, right? People first they have a fear, what they'll tell me, something, any funny incident happened which you're still evergreen for you,
See, there's been a lot of incidences. Just imagine you're holding a syringe and you want to get an injection done for a 4-year-old, 5-year-old. I'm sure all of the, all of the young mothers realize this, who have a 4-year-old or a toddler, when you take them to a dentist. The fear of it, and that's a very funny thing where sometimes you are scared yourself as a dentist because you're handling with a kid, but with practice it comes. That's very funny because kids are scared of injection and you're taking an injection into the mouth. Okay.
Yeah.
That's very scary for them. And there's a lot, of incidences. Probably it actually looks funny for us, but then on the other common public, it's a scary situation. But then for us, it'll be like this, right? So I'm going to start with something like, how many times do you brush? Okay. So people say, okay, once a day or something like that, and they say, how frequently do you change a brush? Okay. And then this person happens to say, we change it every month. I said, great, absolutely. Someone changing a brush every month is absolutely great, right? So now I asked the person oh, that's great. You change your brush monthly? Yeah, 5 of us use it. It gets worn.
Okay, understood.
So that is what it is. Okay. All right. So I'm going to pretty much cover everything here, people on DC Live. This is your favorite RJ Rudra here, but with Dr. Rudra today. I'm going to be talking about your dental health. What I'm going to talk about is your dental care. And I'm also going to be talking about your oral hygiene. Why do you have to have a healthy smile? Okay. I'm going to start this session quickly. I know I have about 40-45 minutes. I'm going to open this for questions that's going to come in probably on the DC Live chat or on the InMeet chat here. I'm going to cover a few basics. Essentially, is what I'm going to do. But then first, I'm going to start here with something very, very specific. I know. As usual, Srileka is my, is my lab rat sometimes when we want to start something. Okay, here again, Srileka. How much of money do you spend taking care of your hair in a month?
For hair?
Yeah.
I don't spend much.
Don't spend much? Okay, generally, right? A lot of them spend a lot of hair care, right? You spend serum, you spend shampoos, you spend conditioners, and then other hair oil, and people are really worried. How do you feel? Okay, let me put it this way. How do you feel when you see a couple of strands of hair in your comb while you comb every day? Right.
If a couple of hair is fine, but if the full of hair means I feel like heartbreaking each and every time.
Heartbreaking.
Or something like that. Yeah.
It is heartbreaking.
Yes.
But would you feel the same way for your teeth?
I don't think so. No.
No.
Yeah.
But for you to stay healthy, is the hair important or the teeth important?
Teeth.
But why do we spend so much on hair and not on teeth?
So maybe it's externally, right? It's look out.
That's the point that I want to start with, right? Yeah. That's the question that I want to start with. What's healthy, right? Maintaining your healthy hair or a healthy teeth? Okay, it's not that all the hair care specialists are going to run behind me for this, but then that is the analogy, right? So people spend a lot on hair care, and so let's start from something basic. If we're talking about teeth, which one of them is singular, which one of them is plural?
Back to training, Rudra.
Yeah, we'll start from there.
Tooth is singular, teeth is plural. Yeah.
Wonderful. Great. Okay. So how many something, I'm going to talk the first 10-15 minutes, we're going to talk something, 5-10 minutes, we're going to talk something very basic. And then we're going to start with the questions probably of why is oral health important? How often should we visit a dentist? What are the most common dental problems? Is tooth pain a sign of serious problem? All of that we're going to see as we go through this. Okay, let's start with something basic. How many teeth do we have?
I see 36 பல்லு உடைச்சிருவேன் அப்படின்னு சொன்னனால எனக்கு 36 தெரியும், பட் எனக்கு 30, I don't have 36, I have only 32.
Okay, right now it's 32 is a normal
Okay.
teeth. No more 36. We don't have three more, we don't have 4 molars, we have only 3 molars. Okay, right? And in fact, it's becoming extinct. The generation has evolved so that we have 28. So because of the food habits and everything. So there are 2 sets of teeth that everybody has. One of them is the primary, known as deciduous, milk or baby teeth. And that is 20 in number, which is, it starts with, you'll have 10 in each arch. Upper one, lower one, up, low. Up is 20. The lower one is, up is 10 and the lower one is 10. So both put together about 20 of them. It includes your incisors, which is to cut, canines, which is to tear, and your 8 molars, which is 2 each in one of, 4 each in each arch. So that's what it is. Okay. So when do they appear, right? So how do they appear? This is, the first teeth that appears as an infant or as a baby that you have, and then you move on to have the next set of it when you're about 6. These 20 teeth are replaced by the 32 teeth. You have all of them shed and a new set of teeth come, and that starts, the first one starts from, maybe start appearing as early as 4 months to 12 months of age, which is the often, or probably on an average 6 months, right? So that's where it starts from, and then it moves all the way till 20 months. Okay. Then after that, we're going to have something which starts replacing at the age of 6, which is between ages of 6 to 12. These teeth are lost and replaced by the permanent teeth. What is the main function of the deciduous teeth or the primary teeth or the milk teeth? They are beyond eating. Eating is your chewing is the first step, the primary function of a teeth. They are vital for guiding permanent teeth into the position, right? So that's why a malaligned younger teeth, the kid's teeth, can cause to crowding of the permanent teeth as well. Now, from 20, you move to 32 permanent teeth. These are your permanent. They stay forever for the rest of your life. They have a different structure, but the major difference is the roots of primary teeth are shorter and narrower. Okay, so the longer, and they're going to be firmly fitted. That's where it is. And there's something called another set of 2 in each of them, which is 4. You'll have 2 more premolars which will get added, which is 8 premolars will be added to your teeth. Now, most of us have questions around this. When does the first, just quickly talking about all of these, when does the first teeth appear for a baby? That is at 6 months. Okay. And when will it completely? That's about 25 to 30 months, which is roughly about 2.5 years, 2 to 2.5 years. So it starts at 6 months or roughly 6 to 8 months and completes by 2.5 to 2.5 to 3 years. So that's the normal thing. I'll talk about what should you take care, what should you be taking care of it from here on later. Okay.
So, Rudra, I have a question. Before
Yes.
we move on to the next stage, so
Yeah.
there are some parents who are worried, right? I mean, for some kids, you can see like before they, come to 1 year old, right? You can see the teeth started growing, or there are some some kids where the teeth will slowly it will grow like. So, what is the reason behind, or is a really a serious thing where the parents have to look after into it?
Nothing to worry in case if it happens between the same timelines that I'm talking about.
Okay.
In case if it's about 1.5 years, it's about 2 years and none of the teeth have come up, okay, then you can really visit a dentist and to show if there is any underlying reasons. But normally absence of a teeth is a very rare condition. Okay, so it may not happen, but then it could be slow. Could be slowed because of multiple reasons like growth factors, nutrition, and also the sometimes the local factors are your thickness of your bone and the gums. So that can happen, but that's a very rare condition that happens. Normally, it's a normal process that happens. But even if it does not happen around a year or about year and a half, little over that, that's when you probably will want to visit a dentist. Okay.
Okay. Thanks.
Great. Okay. So now we're going to talk about few things. Okay. Why does dental care matters? Okay. Like we were just talking about it. Dental care is very important for multiple reasons because they help us chew the food properly and help us digest the food. Is that all it does? It helps us speak clearly and confidently. That's the second thing. And the most important thing, what is the most important thing? Srileka? It helps you chew food. It helps you speak clearly. What is the most important thing? Have you ever thought about it? Or anybody in the group?
Chew food.
Chew food helps in digestion because you chew food. Help you speak clearly and confidently. Smile.
Yeah, agree. Yes, Colgate smile. Yeah.
It's your smile. So your healthy teeth, confident teeth helps you to smile confidently. Okay.
Yes.
Now, talking about all of these, I'm going to talk about what is normal in dental health. Let's start with how a healthy mouth should look and feel. Teeth. Natural teeth are not pure white. Those commercials and advertisements, they're just going to be, the tingling music and appearance you have, they're just made. Your teeth are off-white, which is danta color. Danta color. That's why it's danta, and your teeth is also considered danta, right? So that's why it is. So they're off-white and slightly creamy. Maybe not too yellowish, but slightly creamy means yellowish. Shape. It should not have any sharp or broken edges. It should not have any visible holes or black or brown spots or any other spotting or discoloration. Feel. You should not have pain when drinking cold or hot water, or no pain while chewing. That's a healthy teeth. Simple, 3 things. It should look off-white or slightly creamy, no sharp or broken edges, no visible holes or black or brown spots. You don't feel when drinking cold or hot water, and you don't feel any pain while chewing. That's it. Then you have a healthy teeth. You have all of these 3, definitely you have a healthy set of teeth. Yes, please.
So, Rudra, whether it's a white or a creamy texture, it's both are a healthy teeth, right?
Both are healthy.
As you said, the teeth may look after brushing, when you look at, you see like there is nothing is there, every teeth are healthy. But still, if they drink hot coffee or cold drinks or something, they feel that sensitive senses, right? I mean, and the koosradun solvanga, usually.
Yes, please.
So what is the reason for that, Rudra? But still your teeth looks healthy, as you said, whitey or creamy.
I'll answer that in a bit. Just hold onto it. That's probably the question that I have. I'm answering in a bit, so you can just get to know about that in a few minutes from now. Okay, that is what it is.
Sure.
All right, great. Now that's the normal healthy thing. And about your gum, okay. Now your entire mouth has 5 components, right? It has someone raising their hand. Okay, right. They have 5 components: your teeth, gum, tongue, palate, which is the roof of your mouth, and the top of your mouth, in other words, and 2 jaws, correct? Upper and lower. These are the 5 things that make up your entire oral health, oral care. Now we've spoken about teeth, we'll talk about gums. Healthy gums are going to be light pink, or sometimes brownish, a little darker, or brown blackish is also normal depending on the skin tone. It should not be bright red or whitish. Okay, that's what it is. Texture, they fit snugly around the teeth, not swollen or puffy. They just look normal. Okay. Bleeding, they should not bleed when you brush or eat. That's a normal gum. Your tongue is supposed to be pink, moist, without thick white or yellow coating. You should not have any burning, persistent pain, or no usual lumps or ulcers that last more than 2 weeks. That's a healthy tongue. Healthy roof of the mouth is also pink, smooth, without ulcers or anything that's around there, or white patches, or no lumps that you feel when you run your tongue around the roof of your mouth. It should make you feel comfortable when you eat or drink. The jaws, upper or lower, when you open your mouth, you should not feel any pain, any pressure, or any clicking sound. This is a healthy oral hygiene, or you can call your oral cavity, okay, because your oral cavity, or the mouth that we consider, is formed of teeth, gums, tongue, palate, and the jaws. If you have all of it, whatever I've said, this is absolutely fine. Okay. Now, we have spoken about the normal oral health. We have also spoken about the function, and quickly talking about 2 things that I talk about. Appearance, I'm going to summarize the signs of normal oral health. Teeth look clean, no obvious stains on the gum line or discoloration on the teeth. Gums are not red or shiny, they don't bleed easily. Function, you can chew comfortably on both sides, no pain while eating hot, cold, or sweet food. Okay. And you're able to speak clearly, there's no constant discomfort. Breath, one important thing all of that causes is your normal breath. Normal breath should not be noticeably foul. Morning foul breath is common, but if bad breath remains throughout the day, even after brushing, something needs attention. It could be either your oral hygiene itself, or it could be systemic as well, because when you have fever, you always have a bad breath in your mouth. You have a medicine, you must have had some bad breath in your mouth. Okay, this is what it is. I'm going to talk something very basic right now. How often and with what should you brush? How often should one brush? 3 times, 4 times, 5 times?
Any multi-choice. Anybody would like to take this answer? How many times? Like, okay, it's 2 times, Rudra.
Okay, absolutely wrong.
Twice a day.
Ideally, I'm talking about.
Okay.
After every meal. Okay.
Oh, it's like goggling, right? Brushing is different,
Brush.
goggling is different,
You
right?
brush every time after a meal. Okay.
Oh,
Ideally recommended dentist. I don't do that either, but I do carry a small brush. If you guys have, if someone doesn't know that, what I do, I'll do that. I'll just put my, video on, or I carry a baby brush that can be carried in a pockets.
okay.
So that if I'm on the travel, you can just go brush anywhere you want. Okay. So this is what I carry with me.
Okay.
That's a
Going
baby
to be
brush.
good.
That's a baby brush I carry with me when I'm on the travel, because if I find a washroom, I can just go brush anywhere I want, so that I can put it into the pocket and nobody notices why do I brush or what happens. So it's easy convenience. That's all. You can carry your regular brush as well. Okay. The next question comes. If ideally is one, I cannot do ideally, then what is the next one? Ideally twice a day, once in the morning and once at night before sleeping. If you feel you must skip one, which one will you skip? You don't have time for one of them. Anybody from the group?
But literally, many of them will skip night, but I think preferring white morning will be better. I think that is what you're going to say, like my guess.
Exactly, right? You can skip the one
In the morning.
Yes, never skip night brushing. That's the logic. But
But
we have
Rudhra,
this.
sorry to interrupt. Before you continue, I heard like there are some international countries where people don't brush in the morning.
We brush in the night.
Brush in the night. Like, is it true or it's myth? What I heard.
I'll explain that to you. I'll explain that myth to you.
Okay.
Okay. Now, why do you brush? You brush for your food items to be eliminated from your. Why is it advisable to brush in the night? Okay. It is advisable to brush in the night because your food particles are the one on which bacteria act and there is decay. Now, you have had food since morning all the way till your night, and then you're going to go to sleep. Sleep is when bacteria are usually active in the night. They're nocturnal. Now, what will happen is there is enough food items in your mouth and you're sleeping, and there is enough time for it to work on the food particles, which is what breaking down is what causes decay. That is one of the major reasons. All right. That is the reason why you can technically brush, and you should not eat anything after that. After your dinner, brush, you go to sleep immediately after, that. And after brushing, before going to sleep, you should not eat anything else. That's the first thing. Second thing is also you can wake up. If you want to brush in the morning, wake up, have your breakfast and brush after your breakfast. We will not do that. Right, Srilekha? We will not do that.
We never think about it.
We'll never do that, because the reason for that is because you should not have had anything after your brushing, because your mouth is clean. That's why. Okay. That's the logic. Right. Now the next question, very basic. What is the type of brush everyone should use?
It should different, no, Rudra, because anybody who would like to take this question, want to answer?
The bristles I'm talking about specifically.
Yeah, understood. Maybe it depends upon the teeth, because some people will have zigzag teeth, some people will have very unique, very equal sizes of teeth.
Yeah, so you should ideally use soft or extra soft. Okay. Hard is not for humans. Okay. Hard brushes is going to extremely damage your gums and enamel. You're supposed to use ideally an extra soft, if not a soft. And then the size of the brush is going to be small or medium. You don't want to use the large edges because it does not reach the corners of your mouth. Okay, next question. How frequently should you change your brush?
Maybe monthly once.
Ideally, yes. Okay. So the indicator is maybe 2 to 3 months is the ideal time to change a brush. However, if you want to, the other indicator is it should not be frayed. Means it should not look like a flower pot. When you draw a flower pot, it's all frayed, right? The bristle should not have frayed. That's how it should not look like. Okay. So that is where it is very important that you change. That's an indicator that you should change your toothbrush. Okay. Now, what toothbrush should one use normally, right? So what do I mean by a frayed toothbrush is this, correct? This is a frayed toothbrush, people. Do you see this? Anybody who's here, who's on the meeting can see this. Yeah. This is a normal toothbrush. This is a frayed. Never let your toothbrush get to the stage. The moment you see them fraying, then you immediately change your toothbrush. Okay. Now, I think the next question is, use a normal toothpaste. The toothpaste, use a fluoridated toothpaste, anything that has fluoride. Nowadays, all of it comes with fluoride. They help teeth protect from decay. How much of paste should you use? The entire brush? What do we do? All the ads show. What do the ads show?
There shows the entire brush.
Is this what you see on your ads?
Yes.
This is what you see on the ads. This is not what it should be. A pea-sized or a peanut or a groundnut-sized toothpaste is what is important.
Yeah. So we got one answer also, one grain size like.
Right, correct. Right. Now that's how much of toothpaste. Is it okay for kids to swallow the toothpaste? Yes, it is. They're safe. Don't worry if the next time your kid swallows the toothpaste, don't really beat them up so much that they're going to stop brushing from there. Okay. That's what it is. Now, most of you might have me a question. Morning time, if you have brushed, the time to brush, the most of the time to brush will be after your breakfast in the morning, provided at night you have brushed just before going to sleep and you have not had anything after that brushing. Okay, got it? Can I use a mouthwash and a tongue cleaner? Yes, you can definitely use a tongue cleaner and a mouthwash. Ensure that you use alcohol-free mouthwashes for the kids if you're giving, and also a fluoridated mouthwash that can help. But how do you use that? Use few drops in probably about 50 to 100 ml of water. Okay, that's going to help. And also when you're using tongue cleaners, don't use the steel one. Nowadays you get a lot of plastic ones, which is going to help you. Use a simple tongue cleaner, or sometimes the back of your toothbrush that comes with those those designs, which is going to help you. You would go ahead and use them. Be gentle. Don't scrape too hard. Don't do that like what you're going to do on your vessel that you cooked pongal. Okay, don't scrape like that. Okay, right. Okay, all right. Any questions on the brushing now? I think I had one question. Probably is electric brush good for kids, right? So electric toothbrushes are generally good for kids, but I would say we can give it to them for about 3.5, 4 years old, because it can improve their efficiency, because they don't have to really brush hard, and it is very safe to use, and also you can put in timers for that. That's one of the major reasons. And then the kids don't really need a lot of manual effort and less effort. Okay, but the age guideline is very, very important, and supervision is what is very important. Sometimes because of the parts and things like that, even if it breaks, the child may swallow it, and it's also available everywhere. So we can definitely do that. Okay, so that's the next thing that I would say. Okay, now how long should you brush? Half an hour, 1 hour, 2 hour, 3 hour?
3 to 5 minutes.
Very good. Any other better answer? You got to brush for not more than 90 seconds, which is a minute and a half.
Oh, 1.5 minutes. Okay.
90 seconds, 60 seconds to 90 minutes, and every side, all the surfaces, the front of your teeth, inside of your teeth. I'll show that demo, probably in the next session or something like that. But then you got to brush your outside surface of your front teeth, your back teeth, and then the chewing surfaces, and then the inside surfaces. 20 strokes each with the paste on. That is all you got to brush. If you brush more than that, it can cause the wear and tear of the teeth. Generally, brushing is absolutely, it removes enamel. So excessive brushing and hard brushing and wrong techniques, if you keep brushing it like you do this on a vessel that you want to scrape scrape this surface out, it's going to damage your enamel. And then the moment you damage the enamel, the major cause of damaging the enamel is sensitivity, Srilekha, that we were talking about. So any right-handed person, just run your tongue around the right side of your cheek at the place where your teeth meets the gum. You all will see some kind of erosions. Do you see that? If anybody, anybody, you can just at least run your fingers also. You'll see one of the teeth with a lot of erosion around for a right-handed. Okay. So that is what it is. 2 more questions. I'm going to talk about brushing. Can we use a neem stick?
Yeah.
Can we use a neem stick? We definitely can use a neem stick, but the major disadvantage with a neem stick is it's as good as removing plaques. It's good at it, but the only problem with that is it can damage your gums, especially if it's for the kids. All right, and if or the elders also, it can damage your gums, but it has an antibacterial effect even with miswak or your neem teeth. Happens the same way. Now I'm going to talk about nothing against any brand here, because I thought I will talk without the brands, because in case we put this on YouTube, I do not want to kind of use you use this as this one that we spoke about, their paste or something like that. But generally talking, any fluoridated toothpaste is actually good. Any recommended toothpastes, I would advise Colgate Total is okay. They're good. Sensodyne is great. Pepsodent, normal, okay. But then they also have, it's got a little bit of abrasion. For kids, any of these is good. And use a kid's brush because the head is small. It's not going to impact their the cavity. Fluoridated toothpaste is very, very important. The toothpaste that I do not recommend personally, Patanjali, Dant Kanti, nothing against Baba Ramdev, but that is what it is. Himalayas, Dabur Red or Miswak. The reasons being, these are all high in abrasives. Even Colgate Active Salt or anything that has charcoal in it, they're going to be very thick. They're going to be abrasive. They're going to erode the teeth and make it sensitive over a period of time. Sensodyne as a toothpaste, definitely people say it helps. It repairs the nerve endings and everything. But that's also a kind of a management. It does not completely relieve it. It just blocks it. Especially for kids, any of these toothpastes are okay. All right. So that is what it is.
Colgate Purple, Rudra.
That's new in the market. It's just change of color.
Okay.
It is just change of color. Now, salt water goggling is very, very lukewarm, not hot water. Salt water goggle always helps teeth get better. It's going to help things better. But the only challenge with salt water is if you already have a toothache and things like that, it may worsen it. Okay. Can I use a hot pack or an ice pack if I have a toothache? Sometimes it is better to avoid it because it can worsen it because of the pressure and things like that. Okay. So avoidable toothpaste, charcoal toothpaste, salted, anything that does not have non-fluoride, anything that has, which has high abrasive rate is what I would not recommend as a toothpaste. Okay. Right. Now, quickly moving on. I'm going to talk about the biggest nightmare of mothers, right? Tooth decay for kids. What is tooth decay? Tooth decay is basically a slow eating away of the tooth. When bacteria in the mouth feed on sugars from food, they produce acids. These acids slowly dissolve the outer layer of the tooth, which is the enamel. Tooth has 3 layers. Enamel, which is the hardest part in the body, even harder than bone. Then the dentine, which is the softer. And the next one is your pulp, which is the nerves. Okay. Over time, this creates holes or cavities, which can cause sensitivity or pain. Okay. Now, why is it common in kids? Okay. Why is it common in kids? Correct. That is what it is. Now, if I can just bring up, don't get scared. Don't really get scared. Okay. Can I show some pictures, please? Do you see this? Do you
Yeah.
see the images?
Yes.
So this is a tooth, and the ideal one is this, right? You can see the three layers in this. The outer layer, that's the enamel. This is the inner layer, the dentin, and this is the nerve endings and the pulp and all of that. Now, this is your decay. It progresses and causes on the top when it goes here, and when it affects here is when you start needing a RCT. Here, it shows a filling that you carve it out, and then you put the filling back into it. Now, this is how a tooth decay happens. Okay, this is where it gets into it. Now, let me quickly talk about why does sugar offer this? Because sugar offers sugar is very active. I mean, it is a great nutrient for the bacteria to act upon it, and they both work together. And then it also gives a sticky environment for the why is sugar the bad man, not any other food? Because sugar is going to give nutrient to the bacteria. It has a sticky nature so that it helps along with the saliva. It helps the bacteria to stick onto the teeth and it starts working on it. And that is why the chocolate, sweets, biscuits, any sweetened juices or soft drinks is going to worsen the decay. Now, with all of these things, it's going to affect a kid. Can kids eat chocolate? Is a question. Can kids eat chocolate? Anybody?
Maybe in certain limits.
Moderate.
Yeah.
Okay. They can definitely use chocolates. Okay. Kids can always use eat chocolate, but it will have an impact. The more often they eat, and they're stuck on the teeth, as I said, they give an environment for the bacteria to act upon, the higher risk of the decay. Now, if you use sticky sweets like caramels, toffees, lollipops, or anything that's jaggery, which are going to stick, those are worse for the kids because they cling to teeth and stay longer. Something which just like a juice, sometimes not thick juices, the normal juices may not stick onto the teeth that long. So, who are the common kids for whom the decay happens? Kids who snack frequently throughout the day with sugary caramel, toffee, lollipops, and people who often sip sweet drinks, milk with sugar, juices, even health drinks, they are more prone to decay, and they are supposed to increase their brushing frequencies. Maybe you can do it twice. If you have a school-going kid, once in the morning when they go to school, or when they wake up, one when they return from school, and one before sleeping. So I know it's a tough task to get a kid to brush, and that's why all the fancy toothbrush and toothpaste have come, but that's very important. You can start. So do I really need to be worried if the teeth is going to fall away? Anyway, they'll fall away, right? Do I really need to be worried?
Of course.
Why?
Because you lose your strength, right? You can't chew the food. As you said, like we can't carry the confident smile, especially.
That's not the answer. They don't let the mother sleep.
It won't grow. Okay.
Yeah, it won't grow also there, but then the biggest reason why you should have your kids do this, it doesn't let the parents sleep, especially the moms, right?
That's true. Yes, agree.
Okay. Exactly, Veena. I know you unmuted to say something, right?
I think last week I had to consult Rudhra for one tough night that I had. So, yeah, thanks, Rudhra.
So that's one of the major reasons. So you should ensure, yes, the teeth, the 20 teeth has two functions. One, primary, it helps the kid feed. The second thing it also helps is to hold the position for the permanent teeth to come into the mouth, to erupt. Okay, so that is why it is very important for this to stay in position. Even if you have to have the teeth removed, you need to maintain that space for the permanent teeth to erupt. Okay, right. This is very, very important. Okay. Now, I'm going to talk about any questions around the DK, anything that someone has a question. I'm going to quickly go over and, talk about three things: teething care in babies, dental care for children, and for adults. And that's what we're going to talk about. And lastly, we're going to talk about when to see a dentist in the next few minutes. And over-the-counter dental medicine that parents can keep at home is what we're going to see. Okay? Yes, people? Any questions?
Okay, there is a question in my WhatsApp, Rudra. So, how do we brighten the teeth, and what are the things to follow? Like,
okay, so as I said, there's no need to whiten the teeth because the teeth, literally, as I said, is going to be creamy or off-white or a little more than your normal white. It's not going to be white. It's not going to be pure white. If it's not yellowish indicate your enamel is worn out, and then your dentin is seen. Dentin is the second part of your teeth. So if it's yellowish and if it's causing sensitivity, then you visit a dentist. But there's no need as such for someone to get their teeth being bright white like in advertisements. It's not necessary. People have that myth. That's a myth. We always love being white and fair and color. That's what it is.
okay. So, Rudra, when you talk about the myth, I have few questions related to it. Is it better, removing the tooth better than saving it?
It again depends, right? If it's going to impact the function. See, I would say I'm going to get away with the teeth, but then if you remove it, you can't bite something. Okay, take it this way, right? You have pulled out a tooth, which is right in the front, the top jaw. What would you do? It'll have two impacts. One, you want to bite an apple. Can you bite an apple?
No.
You'll not be able to. Correct?
Yes.
Yeah. So it impacts functionally and it impacts aesthetically, which is appearance wise. You may lose your confidence. You may smile with your hand covering and all of that. So the conservative way of saving a tooth and seeing if it can be restored is the best way always. Okay. Yes, Veena.
Yeah, Rudra, just wanted to know in kids, like kids who are like 7, 8 or 10 years old, if there is a decay and if they're doing a root canal. So after that, when they ask us for what kind of cap should we put on the teeth, what is that you would advise for? Because they come in different ranges, but as parents, we wouldn't know which is the best for the kid. Because I think by the time they are 12, the milk teeth would go off.
Correct.
So I would just want to know from you what is the best that we should.
So I would recommend anything, even see, most of them, there are two types of caps that come. Usually the metal ones, the metal alloys. Kids usually lose a little bit of confidence if it's a metal alloy, especially since they have a small mouth and it's visible. So if we can get something which is like a ceramic, which is white colored, they have a lot of confidence. But cost wise, it could be a little higher, and it's going to last. We are getting it done about 5 or 6 years, and then this has to be there for about. It starts spreading from 9 to 12. So maybe if we have to maintain that, ceramic is probably something that you can consider, Veena. Ceramic caps.
Okay.
That's the best material. Composite or ceramic caps. Nowadays, composite and ceramic caps. Okay. So that's what it is. Okay. Quickly, I know last few minutes, we're just going to talk about, we spoke about brushing, we spoke about decay. Now because we may have a lot of infants at home, the biggest question is, when can infants have sugar? Okay. So when someone is being nursed, when a baby is nursed, there's no, during nursed by the mother, there is no need to add sugar, or, you don't have to introduce. Maybe after the first 6 months, when solid starts, or when we start giving supporting foods, try avoiding sugar to milk, porridge, or cereals. Maybe they get used to the natural taste of foods. I would not say in the first 6 months. Even for bottled milk, I would really not advise until a year, but it is okay to give sugars in moderate levels. Okay. But the golden guideline is delayed added sugar helps better set of teeth, definitely. Okay. One thing to avoid, never leave a baby sleeping with a sweetened bottle in their mouth. Probably you put the mouth, because that's very easy, right? You can be, working, even you can be doing a lot of things, but then that's one thing to avoid. In babies, the common signs, drooling, which is a lot of saliva more than usual. Babies will drool, kids will drool, but then if it's more than usual, that's one thing. They want to keep chewing on things, that means there's pain somewhere in the gum. Okay. Now, when you touch their face, they feel irritability, there is pain. That's something that you'll have to look at it. What are the do's? Always give a clean bottle, feeding bottle, and then give them something interesting, soft bristles or a wet cloth initially to start cleaning their teeth. Gently rub the gums with a clean finger or soft wet cloth until you have them start brushing. Wipe the baby's gums once or twice also should help. All right. What are the things to avoid? Do not apply random gels or home remedies without any advice for the kid. Do not use honey inside the baby's mouth. A lot of them use that, or a clove, especially if they're under 1 year, it's kind of dangerous. Avoid sweet biscuits or caramels and candies during that. So for children, like what Veena was talking about, very careful about parents should help supervise brushing until about 6-7 years of age, and then they're on their own. Regular brush twice a day, normal food habits, no sugars, and that's great. For adults, brush twice, I would say after every meal, clean the tongue, and then avoid smoking, tobacco, alcohol, and sugary drinks. That can cause a lot of erosion and everything. Just give me one quick moment. All right. So that is what is very, very important. So you do that. Okay. So with all of these is the kids, right? Normally kids come up and ask for parents, right? Ask parents for something like this. How much of protrusion, which is the upper teeth being ahead of the lower one, right? So protrusion of your upper jaws. Normally people say that there's a lot of cling and fancy things. I want to use Invisalign and all of that. Do you really want to use that? If it's not impacting functionally, do not do any clips or braces until the age of 17, 18, because if the doctor advises under the growth period, which is about your 12 to 16, 17, fine, but then wait until that completes. And then if there is no functional or if there is no occlusional impact, then you don't have to do clips and braces, okay, for them. Last bit of it I'm going to talk about is how frequent should you visit a doctor, okay? The first visit for an infant is by the first birthday or within 6 months of the first tooth appearing, just to see if everything is normal. Anytime, if the teeth appears discolored, if you have white spots or brown spots, swelling, gums are bleeding, red, and then the kids are feeling irritated or painful when you touch their jaws. For kids between 3 to 12 years, I would say every 6 months, or urgently when it is toothache, lasting more than 1 or 2 days. If it's broken or chipped, if they're playing, that's very, very important. It needs a dental visit. Loose tooth, pain, swelling, bleeding gums. That's very important. Adults, maybe once in a year, but very important. If you have a sudden severe toothache, swelling in face or gums, something is broken, you feel bad breath is an indicator of something systemic. There's something called DKA. It's very common in India because of diabetic ketoacidosis. That's in adults, usually with diabetes. What happens is you have either a fruity smell or a bad breath. Now, bad breath and diabetes is something which is uncontrollable, but the only way is keep sipping water, or maybe you can just keep brushing more than once so that the bacteria erode and keep your sugars under control. That's what is very, very important, but it's a normal practice that happens. Sometimes it is systemic, so we cannot really do much about it. Okay. Now, all of us want to know about over-the-counter drugs that we want to keep at home for kids. When you have a kid at home, keep paracetamol. It's okay to use paracetamol as a toothache when, probably the normal dose for the kids. Then ibuprofen or brufen, or sometimes paracetamol and brufen together. Some normal Ora gel or something, which can, but never use this for any children under 2. I would really say 3 years. Do not use it. People use clove oil. That can also help. These are the few things. And antibiotics, yes. People usually give, I would say, Mox Kid is something that I would always tell someone to have at home. You can go ahead and give that, probably the Mox Kid syrup, which is at the end of the day amoxicillin. That's going to help. But then if it's only swelling or extreme tooth, when antibiotic, it can be given. But otherwise, the normal ibuprofen or everything can help the kid. For adults, these any painkiller should help, but that's for the relieving. But then if something something needs to be intervened, please visit a dentist. Okay, these are the common things that I wanted to talk. Now, I'm going to leave the floor open now in case someone has a question, comment, something to ask me, or something that I did not cover, or probably I was not looking at the chat, probably. Right, so I think those are the things that I really want to cover in the next few minutes before we close. Okay, anybody has any question or something? I know I can see Mani here, I can see Veena here. I also can see a lot of others, people, Srileka, anything that's coming.
So I got one more question, Rudra. So now people, they use the caps, right? There are 2 types of cap, permanent cap and like temporary cap. They can remove, clean it and wear it. So how to maintain it? That is the question. Like if there are some people who go for the permanent tooth cap, right?
See, permanent, there's nothing much to do. You can use your regular way of brushing. Okay. So that's part of it. Maybe visit a dentist to see if it's fitting. And see, there's no need to alter anything with a permanent cap unless it does not disturb you or it's causing an impact on your cheek or anything like that, or cheek or gum. But if it's a removable one that you're wearing, which is you take away at the night when you're sleeping, the first thing is never wear a denture or a cap and sleep. There's all possibilities of someone can swallow it. So it's 100% not a recommended thing to sleep with it, whether you're traveling or whatever you're doing. But to clean them, you have any of the mouthwash or dental solutions that can clean it. Keep it for a few hours to overnight. It will help. And then you can take it out. Just use a brush with your hand and brush it the regular way you brush, and then put it back. If you don't have a dental solution for whatever reasons, a pinch of salt and water will definitely help keeping it, cleaning it, Srileka. Now that brings me to an important question. Can you brush without a paste? Can you brush without a paste?
I think yes.
Okay. Anybody in the crowd? Can you brush without a paste?
Yes, of course.
Very good. Great. You can definitely brush without a paste. The reason being, toothpaste is just an agent. Ash, yes, it was used, and that's where we have come to, but then it can help. It's very abrasive, but yes, once or twice it's not going to make it bad for you. It is an agent, like ash, toothpaste, charcoal, even the brick powder. All of these are agents at the end of the day, including toothpaste. Toothpaste is also just an agent like what we had. We have evolved, but using ash is not a bad thing also. Yeah, neem stick as well, as I spoke, you can use a neem stick as antibacterial. The only thing that it can cause damage to your gum, cheek, and it cannot really it cannot remove the plaque in between, it will not clean in between two teeth. That is where it will impact. Otherwise, neem stick is also fair enough.
Good, Rudra. Thank you.
All right.
Question?
I hope this was useful, people. Someone had any questions? Probably I had a thing to cover. That's what I wanted to cover, basically, in a flow where you might have some other questions. I think the most common thing is toothache or tooth pain, right? When do I see a doctor when I have toothache? I would say immediate. But if you are using over-the-counter drugs for relief, the next opportunity you have to see a dentist is what you will have to see you'll have to see the dentist. Okay.
Good, Rudra. So there is the last one more question. I mean, people are just, I mean,
Yeah, please.
So they're asking about the teeth aligner. I mean, tooth aligner. I mean, nowadays you see lots of advertisement, right?
Invisalign and everything, right?
Yeah, the aligner and all. Is that as advisable? It is good. We can use it if anybody want. I mean, they want to bring it in the shape like.
Yeah, I'm going to answer it this way, right? So let me put it across this way. Give me one quick moment.
Yeah. So by the time, so யாருக்காவது ஏதாவது கேள்விகள் இருக்கா? So you can ask any question. So he can give you answer in Kannada, Hindi, Tamil, little bit here and there, Telugu also.
No, little bit here and there.
Telugu, yeah.
Telugu is good because my wife is a Telugu. So
Okay. Okay.
That's why I stopped you and said, don't say little bit. Okay.
Understood, Rudra. Yeah.
Okay. So someone having an alignment, something to this, like, see, this is going to be a little, your 1 to 2 millimeter, I repeat, 1 to 2 millimeter of your upper teeth being in front than the lower is normal. That's a normal thing. Okay. So if you see, this is also normal. This is the normal and this is the correction they're telling because it's inside. Okay. But however, you see all of these. All right. Can I just blow that a little bit?
Yeah.
Okay. So this is normal for you. All right. So note that. This one in the front and the side is normal. Okay. If it's like this. Anything that has a little bit of crowding. All right. Like if it's jumbled, if it's not aligned, then you visit a dentist for a treatment. But then you're not biting your lips, you're not biting your tongue. You're able to chew. Then don't really worry about it. It is always going to be a little ahead of your lower jaw. So the upper jaw will be in the front always. Okay.
Yeah.
That is a normal thing. So, and this is the normal alignment. Upper and lower should be in the same line. If it is moved, it's slight 1 or 2 millimeters, it's not a problem. Don't get into clips and orthodontic treatment or anything in case, especially this, if there is no functional impact. Okay? Clear, people? That's very, very important.
Good. But last and final question, Rudra. So there are people who eat only at one side of the mouth, right? They chew only either a left side or the right side. They don't use equally. Like it is also will like weaken your teeth, right?
See, teeth with normal wear and tear will happen. Okay. If you're not chewing on the other side, there's a reason why you're not chewing, and correcting that is very important.
Okay.
Why is that you don't chew on that side? What is the reason?
We're not comfortable or like...
No, there is the reason why you're not comfortable, no?
Okay.
There's no practice, right? There's no practice that you have to do certain things in right or left. Correct?
Yeah.
There's nothing that is being written somewhere, recommended somewhere. If you're not using the other side, that means there is something that is not right. Okay? If that is not right, then why is very important.
Find the answer why, then get it done.
Yeah, that's what it is. Okay.
Yes, Rudra.
Right. Any other question? Nothing?
So no more question in chat and WhatsApp. So that's it from our side, I believe. Guys, any questions? Anybody want to comment?
Somebody, ಯಾರಿಗಾவது ಏதாவது ಕೇಳ್ವಿ இருக்கா? ಯಾರಿಗಾದ್ರೂ ಏನಾದರೂ ಪ್ರಶ್ನೆ ಇದೆಯಾ?
York na evina question unda.
ಧೈರ್ಯವಾಗಿ ಕೇಳಿ, ಪರವಾಗಿಲ್ಲ.
One last question, Rudra.
Yes, Vida.
My side. These days, I see people even at the age of around 30, 35, 40, they also get the tooth aligners and things like that. Is there any age by when you should stop going for such kind of dental treatments, or is it like there's no age bar?
So there's nothing as such, Veena, but then as you grow, okay, the bones are going to get stiffer, okay. Maybe the growth period 17, 18 and all of that, sometimes 12, 13, the bones are going to be softer and the corrections can happen easily if all the teeth are erupted. But if you're a 30, 35-year-old, the only treatment is the correction. The bone is going to be very stiff and correction will take a lot of time, number one. And number two is also the fact that it is going to, there's always a chance of relapse. There is nothing as such, but then with age, your treatment prognosis is going to be lesser also. Okay, but we can get it done. But don't use Invisalign and everything which they show up on ads without dental consultation or a reason. People, I see that a lot, right? Like how we wear colored lenses.
Yeah.
Right. Yes, people. Anybody has any other question? No, we're good.
No questions, Rudra. I think lots of things, like maybe it was a silly question or some basic question.
No, absolutely fine.
Yeah, I mean, all the types of questions were very clear, Rudra. I think, yes, whether to use neem, clove, salt, and whether to be happy with white teeth or the milky teeth. So I think for all the questions you have cleared, and it was very gentle way, the way you took the show. Thank you so much for it.
Great. Anytime. Okay. Thanks, Veena. Thanks for that. And people, I'm going to be available on Slack, email, or on phone in case someone wants to just chat with me, have a question or something like that. I'll be more than happy to answer that. So please feel free to reach. I'll see if I can work with Sri Lanka to have an actual Q&A session to the people. Okay. Right. So because here I want to cover the basics, which I've done, but then if someone wants to really I have about 20, 30 people, Sri Lanka, we can really do a Q&A session live. Okay.
Sure, Rudra, we'll do that.
Thanks for this. And as always, I'm very happy to be on DC Live, where we care, we share, and we are on air. Thank you. Bye-bye.
Last but not least, I don't want to miss this session. Rudra, along with you and along with the whole team, I would love to wish Veena a very happy birthday at the end of the segment.
Thank you, Shilika.
Wish you happy birthday, Veena. Thank you. Thanks, team.
Thank you all. Stay tuned to
Thank you all. Thanks.
Thanks, Rudra. Stay tuned to DC Live. We care, we share, and we are on air.